Welcome to Caring for Your Feet, presented by the Canadian Association of Wound Care. During this video, we'll be discussing techniques for proper foot care, how to choose proper footwear, and foot examinations for people with diabetes.
Hello, my name is Miriam Boutros. I'm a foot specialist at Women's College Wound Healing Clinic. I'm going to be talking to you today on this video on the importance of preventative foot care for a person with diabetes. Joining me on this video is the wound care team and a few of our patients that will be talking to you about the importance of foot care and some of their insights and journey into foot care. We're going to start off by talking to you about the importance of the foot care team.
I see my health professional about every 6 weeks, 5 weeks in the summer because of the increased activity. Normally, the inspection involves checking for pulses, checking for temperature differences between the feet. Then they look for fungus between the toes. Then there's nail care. They trim the nails or grind them down. And for me, this is a good preventative step and helps me maintain good foot health.
I take a preventative viewpoint to foot care. I see my healthcare team about once every 4 to 5 weeks. Sometimes that's just for ordinary care. Sometimes it catches things that I need to know about.
Now we're going to be reviewing general foot care techniques.
Foot care for me as a diabetic means looking at my feet twice daily, once in the morning upon wakening and once before going to bed at night. And what I'm looking for essentially is any wear and tear to the feet during the day. I'm walking about, I'm going upstairs and downstairs, and I'm looking for any wear. I'm looking also for the development of any fungus that may have occurred in this time period. And if I do find these things, then this alerts me to the fact that I need to speak to someone on my healthcare team.
If you told me 10 years ago that foot care was important to health, I wouldn't have believed you. Now I have to be very careful about my feet, mainly because I can't depend on how they feel. As a diabetic, I have neuropathy in my feet, which means that the nerve damage to the feet means I can't depend on just feeling what the feet are telling me.
Doug, can you share with us some of your foot washing routines?
You really have 4 steps at looking at your feet every day. You have to observe them, you have to wash them with warm water, not too hot. Make sure that you've dried between your toes so that no cracking can occur, and then use a cream.
Visiting your healthcare professional on a regular basis is important so that we can examine your feet regularly and detect any problems as they arise and deal with them in a timely fashion.
Michelle, who's here for the first visit. She's been recently diagnosed with diabetes, no previous history of ulceration or amputation.
Good morning, Natasha.
Good morning.
Has anybody ever examined your feet before?
No.
It is very important because foot complications are very common with diabetes. So if you don't mind, we'll just take a look and see if there's anything that needs to be paid attention to. Natasha, it's very important that you look at your feet on a regular basis each day for any abnormalities. When we inspect a foot, we're looking for bony abnormalities or irregular shape. We're looking for a callus, that means excess pressure, a blister, your foot is moving in relation to the footwear, or even cracks in the heels, and those are all sources of entry of bacteria along with an ulcer, which is an opening in the skin. Fungus infection often starts in the 4th and 5th toe web and then spreads proximally, or dryness on the bottom of the feet like a moccasin distribution that goes around the side. In addition to this, we check the circulation. And poor circulation is also a risk factor for amputation, and most of those amputations can be prevented. There's an excellent and bounding pulse on both sides here. The last thing we do is to check for sensation. And persons with diabetes lose protective sensation. Natasha, can you feel this?
Yes.
Okay, I'd like you to tell me when you can feel me touching your toe.
Yes.
Close your eyes.
Yes. 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 Yes.
So there were 3 negative out of 10, and there is not complete loss of protective sensation. We usually reserve this for individuals with 4 or more negative tests. This means that Natasha has a good foot exam, but should be examined on an annual basis. If we detect any of the abnormalities mentioned, you should go and have an examination and treatment with a qualified foot care professional.
You can make the most of your visit with your healthcare professional by asking the following questions. What is my main problem? This might include, for example, has a wound developed, or is there cracking or blistering that concerns you? What do I need to do about it? And why is it important for me to do this?
Proper footwear is an important part of good foot care. Your team will advise you on the kinds of orthotics or shoes that are individual for you.
The virtue of my healthcare team is the fact that they've been there, done that, and they know the answers to the questions I have. And so initially I didn't know anything about foot care, and now I feel quite confident at asking my healthcare professional about things that I can do to prevent anything from occurring that's going to harm my feet or me.
Selecting proper footwear is very important for people with diabetes. There are also important points to remember about wearing your shoes. We'll cover them here. Have your shoes professionally fitted by a footwear specialist. Professionally fitted orthotics may help. Buy shoes with closed toes as they protect your feet from injury. Don't wear sandals. Buy shoes late in the day as feet tend to swell. Shake out your shoes before you put them on. Wear shoes at all times, both indoors and out. Choose shoes with low heels, that's less than 5 centimeters or 2 inches high. Change your socks every day.
I wear special shoes, and these were shoes recommended to me by my healthcare team. The shoes are inspected as part of my 4 or 5 week visit to the healthcare team. The shoes are inspected both internally and externally. The orthotics are also looked at. I'm also getting new orthotics this year, again preventing any kind of damage to the footwear. And if the footwear is looking though it's worn, recommendations made that I get a new pair, and I do that without even blinking.
We hope you have enjoyed this video and found it useful on preventative foot care techniques. We want to remind you that the patient is the most important player on the team. And if you're a person with diabetes, remember to check your feet regularly, visit your healthcare professional frequently, and if you detect any problems, seek help immediately and make sure that your feet last a lifetime.
Make sure your feet last a lifetime.
For further information, please visit our website at www.ciwc.net/diabetes and healthy feet.